Greetings, this is a video about hazard assessment at Pusat Kesihatan UTM prepared by Yao Kanqi and Kuzali under the supervision of Dr. Nimi and Mr. Ali. The services provided by Pusat Kesihatan UTM consist of dental, medical, pharmacy, diagnostic and X-ray, and physiotherapy. The possible hazards from working at the clinic could be either stick and sharp injuries, which can have the danger of exposure to bloodborne pathogens due to needle stick or contact with sharps, and it can also cause work-related stress because it is stressful and emotional situation in caring for those who are sick, and the lifting and supporting and moving the patients at the clinic can cause a lot of bending, twisting or lifting, which can cause injury. The fourth hazard is the radiation exposure from imaging procedures. Each imaging procedure contributes to a slight increase in the likelihood to develop cancer later in life. The fifth hazard is dealing with patients in the same space. Due to various activities involved, there is a possibility of contamination from patients. The potential health effects from working in the clinic can be airborne diseases, infectious diseases and all infections, asthma attacks, vegetation, burnout, musculoskeletal injuries. When you are overexposed to a hazard, there can be a certain risk. The first risk is physical hazard, but it can cause discomfort, stiffness, and loss of mobility, and it will be hard to perform daily tasks. The second risk is chemical hazard, but it will cause inflammation of mucous membrane, and it will stimulate change in respiratory process. The third risk is the mental burnout, where it will drain workers' energy, causing workers depressed, cynical, and angry, and long-term burnout, in which will increase susceptibility to flu, common cold, and other diseases. The fourth risk is the biological hazard, which can cause skin irritation and allergies to infection such as tuberculosis, AIDS, and cancer. Next, I will be talking about the hazard assessment. The first activity is the needle stick and sharp injuries. The type of hazard of this activity is physical, where the consequence can be sharp injuries, contamination, or disease. The risk of this activity is 12, which is considered as medium. The control measures to prevent this hazard from occurring is to wear gloves, hand pack extra extension when handling the equipment. For the second activity is work-related stress, where the type of hazard is psychological. The consequence of this activity can be mental illness, where the risk is 9, which is considered as medium. The control measure is to consider flexible work schedules and offers free screening tools by the clinic. The third activity is lifting, supporting, and moving, where the type of hazard is ergonomic. The consequence of this activity can be neck, shoulders, and back pain, and also musculoskeletal injuries. The risk is 6, which is considered as medium. The control measure is to maintain muscle strength and flexibility and use suitable techniques that don't strain body. The fourth activity is radiation exposure from imaging procedures, where the type of hazard is physical and the consequence is cancer. The risk of this activity is 4, which is low, and the control measure can be wear protective suit and follow the protocols for imaging procedures. The fifth activity is dealing with patients in the same space, where the type of hazard caused by this activity is biological, and the consequence is disease contamination. The risk of this activity is high, which is 15. The control measure can be wearing masks and gloves while staying in the same space with patients. For the initial hygiene framework, first we start with anticipate and recognize the hazard, then we evaluate the exposures. After that, we control and confirm protection from risk. For the risk assessment paradigm, we start with the hazard assessment, which identify and investigate health hazard and determine hazard factors based on prior experiences. And also we carry out exposure assessment, which we gather information on hazard exposure via modeling measurement. And after that, we carry out risk categorization, in which we determine the possibility of harmful health effects and hazard and carry out actual panels of hazard factors and exposure to reduce hazard. Last, we carry out control and confirm protection from risk, in which we introduce practices that will assist in reducing health hazard, choose controls according to hierarchy of controls and control banding, and select the most efficient method of implementation. For the preventative measures of the hazard, first we can use proper lifting and transfer techniques, in which we use knees instead of back while lifting and wear comfortable shoes with good shock absorption. We can also eliminate barriers to access mental health care, in which we provide workplace and community supports for health workers. And third, we can wear personal protective equipment, in which we wear face masks to cover eyes, nose, and mouth, and wear gloves to prevent touching blood, body fluids, and secretions. And fourth, we can prevent needle stick and injuries from other sharp instruments by cleaning used instruments and dispose used needles and other sharp instruments. And for the last measure, we need to ensure a safe waste management by treating waste or contaminated equipment in accordance with the procedures and regulations. For the hierarchy of control, we are taking cut and sharp injuries as our example. The most effective method would be eliminating the risk by disposing the used needles. This is followed by reducing the risk via administrative measures by developing guidelines and providing training. The least effective method would be reducing the risk via PPE. The medical practitioners must always remember to wear PPE. That's all from us. Thank you.